Hello, my name is Brandy. I'm going to be doing your head to toe assessment.
Okay.
Okay. First, I wanted to ask you, what is your height and weight?
I am 5'5" and 130 pounds.
Okay. Next, I'm going to check your blood pressure, which I am using a prop to do. And I am going to check your pulse and your respirations at the same time for 30 seconds. Okay. That was all good. Do you have any pain right now?
No, I do not.
On a scale of 0 to 10, with 10 being the worst pain you've ever felt, what would you be?
0. I am a 0.
Okay. Next, I just need to see your hands and your nails. And I'm going to check cap refill, which is brisk. Skin is warm and dry with no lesions, no masses. Do you have any issues with your skin that you know of?
No.
Okay. Nails did not have any ridges or clubbing or thickness. Color is appropriate with ethnic background. I just want to check to make sure that you have good skin turgor. There is no tinting. Next, I'm going to feel your head and your hair. Even hair distribution. No lumps felt or lesions. Is any of that tender?
Nope.
Okay. Next, I'm just going to look at your ears. Do you use hearing aids at all?
No.
Is it tender when I touch them?
No.
Do you get any ringing in your ears?
No.
Okay. That is good. Okay. Next, I'm just going to look at your face. I'm looking for symmetry. Can you look down for me? Can you look up? And then to the left and to the right. Sclera is white. Eyes are normal. Face is symmetrical. Can you puff out your cheeks? Stick out your tongue? Smile? Perfect. Let's see. Okay, next I'm just gonna, if we can take your glasses off for a minute, and I'm gonna look at your pupil size, and I'm gonna check to make sure that you're reactive to light. Just look straight at me. Okay. Awesome. Now if you could just follow this with your eyes only. Okay, pupils are equal, reactive to light, and accommodating. All right, next I just want to look in your nose. It's all normal. I don't see any blockages. Can you block one side of your nose for me? And then breathe in. Okay, and breathe out. And then block the other side and do the same thing. Okay, and if you could open your mouth for me. I'm just looking at all your teeth. You have all of your teeth. Do your gums bleed when you brush your teeth?
Mm-hmm.
How often do you brush your teeth?
Twice a day.
Okay, do you floss?
Sometimes.
Sometimes, okay. We need to be flossing at least twice a day.
Okay.
Okay, and then if you could say ah for me.
Ah.
All right. And next I'm going to check your gag reflex. So ah one more time, stick your tongue out. Ah. There you go. Good. Nostrils are patent. Lips and mucosal is moist and pink. Gums are not swollen. They're not red. They do not bleed easily. Tongue is moist. Uvula is intact. Next, I am going to feel your neck. I'm looking at your trachea. It is midline. I'm going to feel your carotid pulse on this side. All right, and then I'll feel it on this side. Next, I just want to see your range of motion of your neck. So if you could lean your head to the left, to the right, forward, all the way down to your chest, and all the way back. Next, I want you to push against my hand, going down towards your chest. Good. Pull back against it. Awesome. Full range of motion. Now, can you shrug your shoulders against this? Perfect. Strong. Next, I'm going to look at your chest and your rib cage. Make sure everything is symmetrical. Does not look like any use of accessory muscles when breathing. Just gonna listen to lung sounds. Take a deep breath. Good, blow it out. And another. Good. Gonna listen to your back. Deep breath in and out. Good. And here, good. 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 Okay. If you could just take a big deep breath in, I'm checking for symmetry. Breaths are symmetrical, no use of accessory muscles back here. Can you say 99 for me?
99.
Say it again.
99.
And say it again.
99.
Okay, can you tell me if you feel any tenderness when I tap here?
No.
No? Okay. And this side?
No.
Okay, good. Breath sounds are all clear in all bases. No tenderness noted. So now I'm just going to feel your apical heart rate. Okay, apical heart rate can be felt. So now I'm just going to listen to your heart. And I will listen to your apical heart rate for 1 minute when I get to there. So just breathe normal. Good. Okay, I'm going to listen to your heart rate for a minute. Okay, rhythm is regular. S1 and S2 were heard, no evidence of a murmur. Next, I'm going to check your range of motion of your arms. So first, if you could squeeze my fingers. Okay, good. I want you to lift your arms all the way up, all the way back behind you. Okay, good. Now stick them straight out in front of you. Push up against me. All right, and push down against me. And then if you could give me your hands, and then push against me that way. Good. Next, I'm going to feel your pulses. First, I'm going to feel your brachial. All right, regular and +2. Feeling the radial pulses. Regular and +2. You can go ahead and lay down. No jugular distension is present. So next I'm just going to look at your abdomen. It is rounded. Do you have any tenderness down here that you know of?
No.
Okay. I'm just going to listen to your bowel sounds. Bowel sounds are normal, active. So I'm just going to do some light palpation. Tell me if any of that hurts.
Nope.
Okay, now I'm going to do some deeper palpation.
No.
Okay. Good. Next, percussion. Okay, good. Okay, next I'm going to look at your legs. I'm looking to make sure that there's even hair distribution, there's no lesions, no lumps. Do you have any abnormalities on your legs that you know of?
No.
No? Okay. Next I'm going to check cap refill. Cap refill is brisk. Next I'm going to check if there's any edema. It doesn't look like she has any swelling anywhere. So now I'm going to feel the femoral pulse. Okay, the popliteal pulse. Next, the tibial pulse. And then the dorsalis pedis. Okay. Next, I want to check your range of motion. So can you take your left leg and lift it up in the air? And then bend your knee and bring it in as far as you can. Okay, good, and straighten it back out. Do the same one with the right leg. In and back down. Okay, then I'm just gonna feel your hip joints. Does that hurt at all?
No.
Okay, no crepitus is noted. Next, I'm gonna come down here. All right, could you push against my my hands? Okay, pull up against my hands. Good. Can you push out to the sides? Good. And then push inwards. Good. Looks like she has full range of motion. I don't see any tenderness, ulcers, redness, or edema. Flexion is all good. Okay, you can sit back on the side. Next, I'm just going to check some of your deep tendon reflexes. So first, I'm going to check your biceps and triceps. So if you just leave it nice and loose like that. Okay, good. Good. All right, those reflexes are all 2+. Do the same thing here. Okay, those are 2+ as well. Next, I'm going to test sensation. So I have a Q-tip here with a soft side and then a sharp side. So if you could close both of your eyes for me and tell me if you feel soft or sharp.
Soft. Sharp. Soft. Sharp. Soft. Sharp. Soft. Sharp. Sharp. Soft.
Okay, good. All right, so now I would like for you to stand up for me. And if you could bend over and touch your toes as close as you can get. Okay, full range of motion is noted, just looking at your spine, making sure that it's midline. Okay, good. Now if you could just bend your knees, a shallow knee bend. Okay, and you can stand back up all the way. If you could twist all the way to your left, twist to your right, and then bend back as far as you can. Okay, good. So now I want you to walk to the table on your tippy toes. Good, and then if you could come back on your heels. Good, and then if you could just walk normal back there and back, heel to toe, yep. And back. Wonderful, you can have a seat again. And the only other thing that I want to do is just to check your peripheral vision. So if you could take this and cover one eye for me, any eye, and then just tell me when you see my fingers.
Right there.
Okay, and again.
Right there.
And again.
Down.
Okay. Cover the other eye for me. All right, same thing.
Right there.
Okay.
There.
Okay, good. Thank you for letting me do this assessment on you. Please follow up with your primary care provider and make sure that you go see a dentist soon.
Thank you.
You're welcome.